There has been a catastrophic failure of medical ethics, human rights and free speech in this country. I know of no health emergency so great as to necessitate the locking up of healthy people for weeks on end. There is no health emergency so great as to threaten individuals with the loss of livelihood, free passage, access to healthcare, education and the right to participate in society unless they submit to a course of experimental injections. I know of no health emergency so great as to require denying dying Australians the mercy to be comforted by loved ones in their final moments. There is no health emergency that makes acceptable the wholesale removal of informed consent. The catastrophic breach of medical ethics was aided in significant part by the effective silencing of the healthcare profession as a consequence of the 9th of March 2021 position statement issued by AHPRA and the national boards. Those who continued to question the response soon learned what happened when such directions were ignored. Around Australia, healthcare practitioners were suspended and silenced, and many remain so, for speaking out against the vaccines and the pandemic response. Those remaining were too afraid to voice their concerns, preventing one of the most important safety aspects in healthcare, open discourse and questioning of the science. I often wonder where we would be now had these two foundational principles, informed consent and free speech, been preserved. Meanwhile, our healthcare system now groans under the strain of disease, while highly qualified professionals remain sidelined. Thousands of Australians suffering from COVID-19 vaccine injuries struggle to get the help they need. We have persistent and alarming rates of excess mortality. Alongside this, we have a crippling hangover of devastation, including economic, social and psychological harm from the lockdown policies, border closures and other draconian measures that were taken, none of which were part of Australia's documented pandemic plan. A Royal Commission must be prepared to investigate the uncomfortable truths about Australia's COVID response, the consequences of the actions taken and the state of democracy in this nation. Thank you.